incidence of cancer is on the rise. So, and as we know, more than 50% of human cancers are caused because of tobacco, because of either smoking or because of tobacco consumption. So, being so important cause of cancer, it is very important that we encourage people to give up the habit. Since it's a no tobacco day, we would encourage all the people to understand the health effects of tobacco and quit tobacco as soon as possible. It can be quit at any stage, the benefits are visible at any stage of quitting, and the risk of cancer comes down only after about 15 to 20 years. So it is very important to quit tobacco today to prevent any other complications. It is not just cancer, tobacco also causes many other problems like heart attacks. So it is important that tobacco should be quit. About oral cancer, it is a very common form of cancer in India, and because of the indigenous habit of tobacco chewing, we get a lot of cancers in the oral cavity, which includes the tongue, the cheek, and the throat. So, as sir was saying, it is visible. The changes are visible because you know what happens in your mouth when you brush your teeth, when you rinse your mouth. You know that there is something abnormal. So, whenever there is something abnormal that you feel in your oral cavity, the mouth as you commonly call, please see your doctor immediately. It could be a dentist, it could be a surgeon, it could be a family physician. Ask them to examine the oral cavity with the help of a torch. Find out what is abnormal. So the early signs of oral cancer are white patches, red patches, which are commonly called as leukoplakia or erythroplakia. These are conditions which may lead to cancer in the future. So these changes have to be followed up, and if it is because of tobacco, they have to be addressed immediately with the intention of quitting tobacco. So these are early signs of cancer. The other important cause of cancer in oral cavity or the tongue is the sharp tooth, which nobody talks about very frequently. Apart from tobacco, people who never use tobacco are also prone for oral cavity or tongue cancers when they have a sharp tooth. How does sharp tooth happen? The enamel in the teeth gets eroded over a period of time because of wear and tear. So when it gets eroded irregularly, there is a lot of chance that the tooth might become sharp and it might press into the surrounding cheek or the tongue. So these changes over a period of time may lead to cancer. So that is also an important cause of cancer, and to prevent this from happening, we generally recommend annual dentistry, meaning go visit your dentist, ask them to examine the teeth, find out if there is any sharp tooth around. If there is a sharp tooth, we have to definitely make sure that the tooth is raised. It should be softened so that it doesn't cause any kind of injury to the cheek or the tongue. So this is one important thing. So maintenance of dental hygiene is extremely important. Prevention, yes, good oral habits, good oral hygiene, visit to the dentist frequently, and quitting tobacco is very, very important because the risk does not come down on the next day. It takes about 15 to 20 years for the effects of tobacco to come down and to make the risk of cancer as zero. So quitting today is very, very important. And there are several methods of treating cancer. Oral cancer has come up in a very big way now. There are chemotherapies, there is radiotherapy, there are laser surgeries, there are local radiotherapies, immunotherapy is an option. So there are multiple options available to treat. When diagnosed in a very early stage, oral cancers are highly curable with a minimal chance of recurrence. It just needs an early diagnosis and follow-up to lead an active, healthy lifestyle after diagnosis of oral cavity cancers. Any cancer diagnosed early is always curable with minimal treatment. Otherwise, there are multiple treatments needed, like a combination of radiation, surgery, and chemotherapy to treat oral cancers. So simple surgery or a simple radiation might be able to cure an oral cancer in a better way. So early diagnosis is extremely important. So as the standee says, you should be watching your symptoms frequently. It doesn't have any specific symptoms. Watch your symptoms, watch your mouth, watch your tongue. If there is anything abnormal like an ulcer, like a swelling, like a redness, like a white patch, all these are warning symptoms that it could be a cancerous growth. Cancer is not the first diagnosis, but definitely it has to be ruled out, especially if the person is a tobacco user. So if there is anything abnormal, put your hand into your mouth, feel it. If there is something abnormal, please go and visit your physician immediately. That is the advice we have for everyone today. Not all cancers are exposed not all cancers are visible. Oral cavity cancer is something that is visible, so it is easy to diagnose. So let us not miss this opportunity, and we advise everyone to act early and to diagnose oral cancer in an early stage rather than going into an advanced stage and requiring very complex therapies.